Hello and welcome. Today I am presenting a mini module called Solve Problems, which is the fifth module of the Leading Healthcare Improvement Curriculum, or LHI. We will focus on how to identify and effectively address barriers to implementing your QI project. Next, let's revisit where we are in the LHI model. In previous sessions, we discussed how to create your vision statement and communicate that vision to stakeholders. Today, we will discuss how to solve common problems that arise in implementing QI projects. First, we'll start with reviewing the goals of today's session. After viewing this session, you should be able to describe some common barriers to implementing QI projects and define the main components of value propositions. Most problems you encounter when implementing QI projects are not technical, but rather barriers that must be removed. For example, if you are unable to acquire the EHR data you need to share with stakeholders, you could also review a few charts to get some data or utilize local information as your temporary data. When identifying and addressing barriers, it's important to break them down into smaller steps that can be addressed incrementally. Let's take a closer look at some of the common barriers that arise when implementing QI projects. Common barriers to change include individual, relationship, structural, and system barriers. When identifying these barriers, consider how you might use the power and resources within your team, as well as your own individual power and resources to break down barriers. We will discuss each common type of barrier to change next, starting with individual. Some individuals who initially resist the change may misunderstand the change, or lack the motivation, skills, or confidence to adopt the new behavior. The good news is that people can adapt with appropriate support. It's important to listen intently to individuals' concerns and use that information to tailor your implementation efforts. People may need to see an example of the project, try out the new behavior, or really understand how this new behavior improves upon the status quo. People may not think they are necessary for change, or might not know what is out there. Seeing others successfully change may also increase others' confidence that they can change too. In addition to individual barriers, you may also encounter relationship barriers while implementing your project. As a group, it may be difficult to maintain a level of enthusiasm for change. When this occurs, it's important to utilize the stakeholder analysis matrix to understand why there is a resistance to change within the team. You may be encountering one or more relationship barriers related to individual attitudes, teamwork dynamics, or leadership. Tailor your approach to the source of resistance. If you think the problem is a miscommunication, try clarifying your message and use active listening techniques. If there is a knowledge gap, encourage training and offer emotional support. In general, to convert resistors to committed members, encourage active participation and engagement. Let's discuss how to address structural barriers next. Fragmented resources, lack of authority, and siloed work environments are all structural barriers that you may encounter in your projects. If you cannot get the resources you need, it is difficult to have an effective process. Helping the individuals who are implementing the change access critical resources may be an important place to intervene. Additionally, if no one has clear authority, it is difficult to make change. You can use your stakeholder analysis matrix to consider how to use influence to move your change efforts forward. Lastly, if key stakeholders are all working in silos without clear communication and teamwork, change may be difficult. Creating opportunities for communication and collaboration may be one way to address this concern. Now we'll take a look at addressing systems barriers, including rewards or incentives and punishments. Rewards and incentives need to be aligned with the desired behavior or goals. As an example, behavior resulting in promotions needs to be consistent with performance evaluation standards. Alignment between system goals and metrics and your project's goals will likely produce greater change at the individual clinician level. Be mindful of punishment as well. Consider how implementing the change initiative may either increase administrative and clinical tasks or remove the need for tasks that the institution rewards. Being aware of how the project may lead to potential punishment for some stakeholders is important and may influence your engagement strategy. Now that we have discussed some common barriers to change, let's discuss how value proposition statements can be used as a tool to address any implementation barriers that your stakeholders may encounter. Let's start by defining value propositions and how they can be used to communicate with your stakeholders. A value proposition is a clear, simple, and concise way of stating the benefits of your project, along with any associated costs or pains accompanying gains. Value propositions are important tools for communicating your project's value to stakeholders. The overall value of your project to stakeholders equals the gains or the benefits of your project minus the pains or inconveniences that accompany the change. Examples of gains include better patient outcomes, cost savings, or increased clinician satisfaction, while pains may be time required for implementation, the financial cost to the institution, and psychological costs such as increased stress or frustration. Value propositions can help you effectively identify and address barriers to implementing your project. Value propositions help stakeholders understand the purpose and benefit of your project. Additionally, they help you understand different stakeholders' perspectives, as well as the barriers and facilitators to change. Tying your value proposition to long-term or ongoing stakeholder or organizational goals will help motivate stakeholders to maintain the project and embed it in the organizational culture. Your stakeholder analysis matrix can be particularly helpful in understanding stakeholders' pains and gains. In order to construct value propositions, you need to know your stakeholders. You already completed the stakeholder analysis in Module 1, Generate Urgency. This same stakeholder matrix can help you understand how to tailor your value proposition for each of your stakeholders. Consider, what is the stakeholder's job? What are their pains? What are their gains? Asking critical questions about how your project presents pains and gains for your stakeholders can help you tailor your intervention and convince stakeholders of the value of your project. You should tailor your value proposition based on your stakeholder and the things that are important to them. Think about their priorities and how your project can add value. Be prepared to overcome resistance based on the stakeholder's pains. Think about the data that is available to help you fortify your message. Data can include anecdotal evidence or information gathered from reviewing charts. Consider how you can adapt your intervention to get better value for your stakeholders. Here are a list of questions to explore before engaging stakeholders. Let's consider potential gains that your stakeholders may receive as a result of your project. Depending on your project, you can highlight how it will help achieve better outcomes, improve patient satisfaction or experience, reduce cost, and even connect project outcomes to broader organizational goals. Consider how your project impacts clinicians, improving their satisfaction and retention by providing better care or by improving a process. Your project may also impact the hospital's overall level of prestige and help with accreditation. Now, let's consider potential pains that your stakeholders may experience as a result of your project. Inevitably, there will be some pains when implementing an improvement project. Maybe it will take some time to implement or will add an extra step to an existing process. Consider using some balancing measures to track unintended consequences of the project. If the project will take some time to implement, consider how the eventual benefit will outweigh this initial cost. Perhaps implementing your project will cost money. Again, consider how this initial cost may be offset by better patient care and eventual reduction in readmission. If your project is perceived as distracting from other priorities, it may be possible to align your project with another organizational priority to increase buy-in. Now it's time to practice developing your own value proposition. Now that you understand the purpose and objectives of the value propositions template, fill in your template with information about your current project. This tool will help you break down each of the elements that you should include in your value proposition to win over the hearts and minds of your stakeholders. Today, we have discussed common barriers to organizational change and how to target your message to stakeholders using value propositions. We hope that you have found this helpful. Thank you for taking the time to watch this mini module, and we look forward to seeing you soon.